My name is Holly Pilson, and I'm an assistant professor of orthopedic surgery at Wake Forest Baptist Health. Coming back to Wake Forest was a very easy decision. I spent about 10 years here training as a medical student and a resident in orthopedic surgery, and then I went away to Arizona for fellowship and practice in Tennessee. And I had the opportunity to see multiple different types of practices and hospitals, and just always had a love for this hospital and what it means to this community. I decided to specialize in orthopedic trauma because I think that it provides you an opportunity to treat very challenging issues, but also gives you some very rewarding chances to help patients return to function. I think that sometimes we meet patients on the worst day of their life, and they're very appreciative for everything that we do to help get them back to their previous level of function or to a new level of function after their injury. What I enjoy most about working with patients is to just see them throughout the course of their treatment. And another thing I like about orthopedic trauma is that I often get to follow my patients for a very long time, months to even years after their injury. I like to see them at their initial injured state and watch their progression of healing both clinically and radiographically to see how it unfolds and to really see them return back to what they were doing previously and the joy that it brings to them and to me. So having been a patient myself and also having multiple family members who've been patients at one time or another, I really think it helps me understand the importance of keeping the lines of communication open with the patient and their family to involve them in their medical decision making so that the efforts can be perceived as a true team effort to reach the best goal possible for the patient and their health.